Hi, my name is Linda, and I am a diabetic. I have been diabetic for about 13 years. The onset of my disease was discovered by a blood test for a life insurance policy. They took some blood work, and they called and said, that my blood sugar was high, and to go and repeat it, and sure enough, they found out that it was high. I started on pills, which was glyburide and glucophage, sometimes called metformin, or another name for it is metformin. Taking insulin, and I take Novolog and Lantus. So Lantus is my long-lasting insulin, my basal, and Novolog is my fast-acting. I take it in a pen, and this is the pen. I basically try to inject 15 minutes before a meal. It's not always convenient, so I am right now deciding that I'm probably going to be going on a pump with my doctor. I'm going to pump classes, deciding which is the right pump for me. So I'll be doing that in the next 4 weeks or so. But until then, yes, I still use my Novolog pen, and I just basically replace the needle every time I use it and wipe it off with alcohol, put on the new needle, twist on, it's very easy, and then I dial in the amount of units I need to take. I am extremely insulin. I still produce insulin, but I'm extremely insulin resistant. In the past, I have a history of an autoimmune disease called dermatomyositis, and I have taken steroids for many years, high-dose steroids, along with a lot of other drugs. So my immune system just does not work well. Typical things that type 2 diabetics have. Like, I'm not overweight, and I exercise, and when I got diabetes, I wasn't over 40, so it's just kind of strange. How I check my blood sugar, I probably don't do it enough or as often as I should. I work and I'm busy, so I kind of just wing it sometimes. But in the morning, I definitely try to check every morning just to make sure, because if you check it first thing in the morning, that kind of tells you how well you were in control the day before. So I take one of my test strips out of this canister and put it in the machine, and you prick your finger. Ouch, it always hurts. Not bad, but I mean, people say, oh, don't you get used to it? And I say, no. And then you check your blood sugar. And my blood sugar reading right now is 177. So that's a little bit high. Normal should be for me, should be between like 89 to 120. Actually, when I am in the right range, I actually feel low, because I'm so used to being high that when I am 110, I feel it. I know that I'm at 110. So I would probably right now take some insulin, some fast-acting insulin. Even if I wasn't going to eat, because it is 177. So if I had already eaten, or because I don't eat regularly, sometimes I'm just not hungry in the morning, I would go ahead and take a couple of units just to bring it down. And I would also take my oral medication, which is the metformin. I take 1,000 milligrams in the morning and 1,000 at night. So this is metformin, and this is what helps your cells take in the insulin. And in the beginning, when I first started, taking all these medications and going on insulin, they said, maybe you don't need to take this. And we just tried using insulin, and no way. I'm just really, really insulin resistant, and if I don't take this, this hardly even doesn't work. So at 177, I'm going to routinely take my oral medication that I always do every morning and take a couple of units of my fast-acting insulin, so that'll, bring me down to about, 130 where I need to be. Okay, so I just tested my blood sugar and it's 177. And if I were to eat now, I would probably have a piece of toast and a cup of coffee with milk and maybe a yogurt. So for me, I would need to inject at least 15 minutes ahead of time, so I'll go ahead and do that now. And I inject enough insulin to cover the calories and the carbs that I'm eating. But because I'm so insulin resistant, I take a lot. So for a piece of toast and a yogurt and a cup of coffee with milk, at my blood sugar being 177, right now I'll take 15 units, which to some people is a lot, but for me it takes a lot to get me down to where I need to be. So I dial in 15 units. I've already put a new needle on this, and then I just basically, I always get my insulin shots in my stomach because it's just easiest for me. I don't have a lot of fat anywhere else, so to put it anywhere else hurts. So I basically do it like this, and I pinch the fat, and you put the needle in on an angle, and then you shoot the insulin in, and you take it out. Okay, now I'm going to demonstrate when I do my long-lasting insulin, my Mellitus. I do this at night. It helps me from going from peaking at night, so that's why I do it at night, not in the morning. Because I also have this thing where I peak no matter what I eat at about like 5 o'clock in the morning. So I use a syringe. This is the vial. Basically just wipe off the top with an alcohol swab. Take the needle, inject air into the vial, and then pull back on it. Again, I need a lot of insulin, so on this long-lasting insulin, I go actually past the 50 mark on the units, just because I get a full, I want to get as much as I can without using another needle. It sounds crazy, but it works for me. So I pull it all the way back, so it's about 60 units of Mellitus. And then this is the needle, and again I just lift my shirt and I put it in on an angle like this, and I push it in.